Okay, so I'm just gonna ask you a couple questions about your
Okay.
mental health today. Are you having thoughts of harming yourself?
Yeah,
Do you intend to harm yourself?
I think so.
What is your plan to harm yourself?
I don't really have one, but I want it to happen.
Do you have access to things to harm yourself?
Of course.
Okay, so we are going to refer you to a mental health specialist.
Okay.
We'll call your mom and talk to her about that, and then we will refer you to the correct one. I just wanted to take a couple minutes to reflect upon asking the questions about suicide to an individual that I was close to. I thought of it as her um, answering those questions, and I think it hit hard to me because I do realize that a suicidal person, they may be acting kind of normal or just have like a couple off days or something where you think, that's kind of weird, but you think that person would never commit suicide. So I thought it was a really good opportunity to realize that even though I thought the person would never commit suicide, that those could be her real answers, and I would need to take those into account and get her help. It made me feel sad that she would think that and want to get her help, um, and just help me feel moved to get her help because I care about her and I would care about my patients and want to get them help too and be the first person in that initiation and be the first person to be able to realize that they do need help. I think it was difficult for me to know what to do. I think I need to work on that more. And I need to realize she would be underage, so I would need to contact her parents and have them in on everything. But with maybe an older individual, like I want to work with MMA fighters who are probably in their 20s or 30s, so realizing how I need to take into account what they're saying and how to get them help when they may not want it. Overall, I believe this is a really productive exercise, and I need to practice asking the questions more and maybe knowing what questions to ask in the response when the athlete does say they want to harm themselves and stuff, and how to react to that because I wasn't exactly sure, and I probably looked really awkward in the video because I was just moving through the questions, and I would like to develop more follow-up questions and maybe questions that get me more information and just have the patient understand what is going on better and be able to express their feelings better. Thank you.